Rhinoplasty is a potentially life-transforming surgery. As someone who myself has had a rhinoplasty, I can just say firsthand that it did change my life to get good work done, and the nose is the centerpiece of the face. So for something that's a minor refinement, no, it won't change someone's look completely. But if someone's nose is really large or really crooked, or they really want major changes made to the nose, of course it will make a change that will hopefully improve their look, but will change it. That really is individually dependent. And one of the reasons I like to image noses on the computer before we do them is so that the person can see what kind of change they'd be looking at, and you can sort of psychologically see if you can absorb that. Because it's a great conversation starter for consultant patients. To be able to see it and say, well, wait, maybe I don't want it quite like that, and I can make some changes. That helps us arrive at what the goals are. In terms of what the experience is like for rhinoplasty, it's changed a lot over the years. In the old days, most rhinoplasty was actually quite painful, largely because the noses were usually packed with gauze. Sometimes 6 or 12 feet of strip gauze is packed into the nose, and it isn't removed for a week, and it's extremely uncomfortable. Nowadays, we don't pack the nose. We have techniques to suture inside the nose to have the same effect as packing, but without the discomfort. So no, most patients don't require pain medicine after rhinoplasty. It's not particularly painful. They do have some congestion, and I've even had some patients ask me if their nose was packed because they're so swollen. But that's really short-lived. It's only a few days, and it's just post-operative swelling in the nose. That's a great question. I get asked all the time, are you going to break my nose? And other than when I was in middle school getting in fistfights, I have never broken anyone's nose. Now, we do make incisions in the bone to move the bone, but that is actually a very careful and delicate process that's done by very sharp instruments. It's all done from inside the nose, so it's probably hard for people to imagine, but no, it's not technically breaking the nose. They are osteotomies, which is the Latin word for cutting of bone, and it's a very delicate and precise procedure. It has to heal over 6 weeks, just like a fracture would, but no, it's not a chaotic fracture like a broken bone.